Assalamualaikum and good day to everyone. My name is Nur Azhar Abdul Hamid, one of the MSU student under IMS International Medical School Faculty. So currently I'm learn about immunology. And my lecturer is Madam Najia. But today I would like to talk about hypersensitivity. So specifically hypersensitivity type 1. Okay. And basically, the crucial role in maintaining health and protecting the human body against the microbiome invasion is played by the our body immune system. Okay, however, exaggerated of the immune and inflammatory response uh, can result as adverse outcome, which is we can call as a hypersensitivity reaction in bracket HR. Okay, or allergic reaction lah. Okay, what does mean by hypersensitivity? So hypersensitivity means that an exaggerated of response by the our body immune system to certain drugs or the other substance. Or hypersensitivity reaction also can define as immune response that are exaggerated or inappropriate against an antigen or allergen. Basically, there are four types of the hypersensitivity reaction can occur in our body. So they're classified as a type 1, type 2, type 3, and type 4. So what is the type 1? Type 1 is a reaction mediated by the immunoglobulin, specifically immunoglobulin antibody E. Okay, so in bracket I can call it as a anaphylaxis. Okay, Type 2 cytotoxic reaction mediated by the immunoglobulin G and immunoglobulin M, IgG and IgM. And type 3 is reaction mediated by the immune complexes. And type 4 is delay reaction mediated by the cellular response. Okay, so what does mean by the hypersensitivity type 1? So type 1 also known as the immediate reaction that involve IgE mediated release the antibody against the soluble antigen. Okay, so this kind of the allergic reaction can occur within minutes. Okay, this very quickly happen to that patient for those have any allergic to any other substances or any medication or any food. Okay, so hypersensitivity type 1 also can call as a anaphylactic hypersensitivity, whereby the patient will develop the anaphylactic shock at the end. Okay, and what is the stimulant or triggers trigger factor that contribute to hypersensitivity type 1? There are few factors actually, and that I can say here is first one is because of the environmental and allergens such as pollen, dust, mites. Okay, and then number 2 is because of the food. Some of the patient cannot take peanut butter, seafood. Okay, some sort of the dairy product such as yogurt, cheese. Okay, and number 3, factor number 3 is because of the insect sting or insect bite. For the patient having a post exposure to bee sting, okay, you can see that there is a lot of clinical manifest that can appear on the body, such as swelling on the lips and tongue. Sometimes patient also complain of having difficulty, okay, in breathing. And number 4 is because of the medication. Some of the patient got allergic to antibiotic, especially penicillin for example, and allergic to paracetamol, allergic to a kind of the medication antibiotic. painkillers, ultraset, something like that. And then the last one is because of the others lah, such as some sort of the patient have an allergy to latex glove, cosmetic products such as perfume and detergent. Okay, so this kind of the contributing factor can contribute to the patient having a kind of the allergic reaction. So, the mechanism of the hypersensitivity reaction itself will occur is very quickly within a minute in the our body system actually. So the pathophysiology that involve a two phase. First phase we call as sensitization phase, and phase two we call it as effector phase. So what is the sensitization phase? Sensitization phase, meaning that when the patient exposed to the allergen, the antigen presenting cell will represent to the allergen of the T helper cell. So when the T cell activation, the process the allergen presented to naive T cell, T helper cell, which differentiate into T helper 2 cell under the influence of the cytokines, for example interleukin 4. Okay, after that the B cell will activate and switching the class from T helper 2 cell, they produce another cytokines which is called as interleukin 4 and interleukin 13, and they promote the B cell activation and class switching to produce the antibody which is called as antibody IgE. Okay, and IgE also will bind to mast cell and basophil, and IgE will bind to fragment crystallization of the epsilon receptor and sensitizing this cell to the allergen. So when IgE binding to the mast cell and basophil, that's why when the patient having the some kind of the allergic reaction, the doctor will proceed with the blood test and order for WBC. So the result, you can see the what I call that, the result of the basophil under WBC is quite elevated for those patients having the allergic reaction. So that one is called as sensitization phase, and then another phase we call as a effector phase. So effector phase is phase number 2, whereby degranulation of activated mast cell and basophil. Okay, activated mast cell and basophil, they become a degranulated, and after that the most important things during the effector phase, whereby our cell release the histamine and protease. Okay, when histamine and protease release from our cell into our body, so you can see that there is a few of clinical manifest that you can see on the patient, such as allergic rhinitis, hay fevers, okay, sometimes the fluctuation of the temperature and so on. Okay, and then the last one is newly synthesized mediator, whereby leukotrienes and prostaglandin and become the contributing further to bronchoconstriction, vasodilatation, and other inflammation will be happen to the patient. So cytokines itself will recruit other immune cells, sustaining the inflammatory response. Okay, so as I said just now, there are a few clinical manifest that you can see that the patient appear on the body itself, such as nasal allergic rhinitis, hay fever, allergic conjunctivitis. Conjunctiva will become a swelling a bit with watery eyes. Okay, soft tissue angioedema because of the increase the cell permeability, and hives, urticaria, atopic eczema, pulmonary reactions such as allergy, asthma, and hypoxic. Patient will develop hypoxic as well. In terms of the allergic reaction, and worst come to worst, a patient will develop bronchoconstriction, vasodilatation, and increased mucus production in their airway. Okay, that's why sometimes a patient having difficulty in breathing associated with allergic reaction. Worst come to worst, the patient will develop anaphylactic shock if we are delay the treatment. When we talk about the treatment, some sort of it is not necessary to proceed with all the treatment, because type of treatment provided to the patient for type 1 hypersensitivity is depend on the presentation and etiology of the reaction itself. Okay, such as epinephrine, bronchodilator, antihistamine, and glucocorticoid. It means a steroid hormone. Okay, normally we will manage the patient with antihistamine, okay, to block the histamine release by the cell, and a steroid hormone first. Okay, normally doctor will give the IM Piriton, and IV hydrocot, 300 mg, and IM Piriton, 4 mg. Okay, and then doctor will observe for the SpO2 level, and to release the symptom lah. Okay, to release the symptom, and then there will be the patient will be observed at yellow zone. Okay, because we are worried that the patient condition is not improved after the first line of the treatment. Okay, and other adjunct therapy for anaphylaxis include supplemental oxygen. So this kind of therapy, this kind of treatment, doctor will start based on the symptom. If after the first line of treatment did not success, and then the oxygen also become drop, okay, 90 and below, so doctor will start the oxygen therapy. We give the nasal prong, will give through the nasal prong or face mask. It depends on the oxygen level itself. Okay, for example, the patient will develop hypoxic and SpO2 below than 89. Okay, automatically doctor will order for face mask, and run 10 liter 8 to 10 liter of oxygen per minute. Okay, and IV fluid. Okay, so to decrease the cell permeability, normally doctor will start the IV normal saline, okay, sodium chloride for volume resuscitation. Okay, and glucagon vasopressor for refractory hypotension. Okay, doctor will give the vasopressor or vasopressin to prevent the hypotension of the patient. Of course, when patient develop the allergic reaction, the BP will be drop a bit lah. So worst come to worst, the BP will be drop, become the hypotension. Systolic and dystolic reading got haywire lah. Okay, and then the last one is atropine lah, to prevent the bradycardic. Okay, so I think that's all for my talk for today. So, and thank you everyone, and have a good day. Assalamualaikum.